Welcome back, everyone. And before the break, we've started Ramadan, so obviously we have started our segment where we are going to be taking different lessons, different things, and translating the Quran for you and applying it in a social sphere, and how, as human beings, as individuals, we need to carry ourselves and to then continue these lessons and this positive way of behaving for the rest of the year.
Exactly, and today we discuss Surah Fatiha. Tomorrow we will be discussing
another one.
Yeah, I think we really have to check it again, and then we have to
double
move
check.
on with
and
that
we will
as
share
well.
it on our Facebook
Yeah, we will
as
share
well.
it on our Facebook pages as well. But right now, moving on with this segment, where today, before going towards the break, I had mentioned that we'll be talking about our eyes. They're very precious. That's why we can see the world, and we should always be thankful to Allah for such blessings.
They also say that the eyes are the windows to the soul, so we need to look after them. And so to discuss the issue,
beauty is always in the
eye of the beholder. Everything positive is linked to light. But anyway, no, what we're going to be discussing are the different issues and illnesses that one can suffer with the eyes. What are the myths out there that we're going to bust? The old wives' tales, and also how to kind of at what point do you go to a surgeon, at what point do you start your treatment, etc. So to discuss all these things, we've been joined by Dr. Ali Afzal Bodla. He is a retinal surgeon and an ophthalmologist.
Hello.
Good morning.
Well, thank you very much.
Ramadan Mubarak. Thank you very much for
Mubarak
joining
to you
us.
as well, actually. It's a
Thank you
pleasure.
so much for joining us. So let's get started. I think
I would love to get started over
go
here,
for it.
and I would love to get started with most common diseases which are related to the retina or at the back of the eye as well,
Sure.
because that's what you're specialized in.
Yes, yes. Well, things have changed, actually, because if you look in the West, the most commonest cause of blindness that used to be cataracts, or what we commonly call as safad motia here. But now one of the commonest reason now is age-related macular degeneration, which, as the name implies, is an age-related disease of the retina. Why? Because the life expectancy has changed over a period of probably last 50 years.
It has extended?
It
or
has
it's gone down?
extended,
Okay.
yes, it has. And people who used to live till their 60s or 50s probably are now living in their 70s and 80s, and the kind of disease process that we are seeing now is slightly different than what we used to have before. Yep.
Okay, no, so because we're getting older, so then what are we seeing? What's happening?
Well, there are many things happening, actually. Our bodies is going through a kind of degenerative process. And the retina, obviously, is a part of the body. So, as I said, age-related macular degeneration is one of the disease that happens because of that degenerative change. And this is something that now we are commonly seeing in our country as well.
Okay, so now when you say age-related degenerative macular disease, right?
Yeah.
So what is that specifically?
Well,
what can we
macula,
expect?
well, retina is the back of the eye. And macula is the center of the retina. Which means for your fine vision, for example, to read clearly, you need macula. What happens in this particular disease is that your macula gets affected. It's not working anymore. And that slowly degenerates, which means patients tend to lose their central vision. They can still see on the sides, but if you would ask them to read a newspaper, that might be difficult.
So is it more of a concave or a convex thing, or does it have to do something with that as well?
I don't think so. You need to imply that on yourself, actually.
No. I'm not applying this on myself, but this is what happened to me because when I went to an optician, this is why he or she said that you've got a concave vision, something's wrong with that as well.
Well, there are 101 reasons actually to have a problematic vision, because the question was about retina. So this is the reason I was saying that.
Yeah, this is more specific to the retina.
This is the most specific, and the second thing that comes into account is diabetes. Diabetes has been a pandemic now in our country. And I'm still not sure. I really doubt that when you are diagnosed with diabetes, do we actually know that it is going to affect our eyes as well? How many of us know that?
I don't think anybody knows that.
Well, the international standards are, sorry to interrupt, international standards are that if you have been diagnosed with diabetes, you should be going to your eye doctor once every year to have a detailed assessment of the back of the eye. So this is something which is considered as a must in the West and developed countries. And that is the reason that do you know the kind of disease that we see here? It's not that treatment is not available.
Okay.
The problem is by the time patient is going to come to you, he won't be treatable. That is the whole issue of the
that's how things are over in Pakistan, and I think I would love to reiterate that once again, that you know, please make sure that you go to your general physician for a checkup after every 6 months or a year, which is very mandatory. I think that's what you need to do, and I myself in my life have suffered just because of the fact that we didn't have any you know, ritual of going to the doctor. Like, so you know, I only went to a doctor after like 10 years, and there was so much already wrong. Well, that was but before we move on towards diabetes, there's one more thing which I want to ask, and that is because we were talking about the degeneration. Do you think that there are different ways of slowing the process of degeneration down?
Well, that is the problem with so many of these diseases. Once you get them, there is no way out. There is no definite treatment.
Okay.
There are multiple studies actually, but the thing is, you can't escape age.
Okay.
You know, eventually the way we are going to get wrinkles, we are going to get degenerations everywhere in the body.
Okay.
So there are things that you can't escape, but there are things that if you know, for example, there is a subtype, there is a kind of macular degeneration in which your vision drops very quickly.
Okay.
So if your vision drops very quickly and you know that you had a history of age-related macular degeneration, there is no point in keep on sitting at home. You should be going and seeing your doctor. So saying that, I think as a country, age-related macular degeneration is still not the biggest of our problems.
Okay.
We have got glaucoma, we have got cataract, do you know, the diabetes, the kind of pathology that we come across here in the country is one of the most severe forms that I have came across actually in last couple of years of my experience in this country.
But with all of these laser treatments available and all different types of surgeons and ophthalmologists being in town as well, does it even help or it does not?
Well, the thing is, I think we have got very good expertise in this country. We have got very good expertise available in most of the cities of the country. The problem number one is, like you have said, lasers. There are 10 different kinds of lasers which are used in eyes.
Which we do not know which one to use.
And it depends, you know, what kind of lasers we are talking about and what kind of disease we are talking about, because still there are so many diseases which are not curable. It's the prevention. It's a prevention.
Okay. Sorry, continue.
No, that's fine. It's just like diabetes actually. For example, if we know that we have been diagnosed with diabetes, then it is quite essential for us to make sure that we are having a good diabetic control, because it's not your blood sugar level, it's your kidneys, your eyes, everything.
Okay, so I think, so the awareness of actually the consequences of not looking after yourself, but because you are a retinal surgeon and ophthalmologist, you've mentioned cataracts, you've mentioned diabetes, and glaucoma.
And retinal detachments. That's
retinal detachments.
Yes.
Now, at what point do people start coming to you? At what point do we need to know? Because the thing is, we've gone past the prevention stage. If we were coming to you, that means that the person didn't live their life in a way that prevented this from happening. So now they're sitting in your office. So what is the different stages now that they will go through if they're suffering from these things?
Sitting in my office, actually, when I look at the patients.
When they're coming for the very first time.
When they're coming for the
very first time.
What is the outcome? 70 to 80% of the time, I wish I haven't seen them. Because majority of the time, they would had come at a kind of stage when I would not have been able to give them the kind of results which I would have given them otherwise.
Yeah, okay.
That is the main problem.
Okay, so what are the results? So they come to you at what stage, and what are normally the outcomes?
Look, for example, let me give you example of diabetes, because we need to be really particular actually if we want to talk about something. If we talk about diabetes, what it causes in eye is something which is called as diabetic retinopathy.
Okay.
Now, diabetic retinopathy has got 4 stages. Okay. It's very similar to the way different other diseases are staged. It has got 4 stages, and in your 4th or last stage, patients would end up having bleeding inside their eye.
Wow.
Now, the problem is, once you have got that, you have already gone to 4th stage, it means you already have developed abnormal leaking or bleeding blood vessels at the back of the eye.
Okay.
You can't undo an omelette, can you?
No.
And this is the kind of the problem. Yes, we can treat it, and majority of the time, despite of the kind of expertise that people have developed in this country, I think they are doing magic actually.
Yeah.
If you look at the kind of pathology that our surgeons deal here in this country as compared to abroad, I think many times we as a nation underestimate them.
Absolutely.
Yeah.
I think they have done a marvelous job, but still there are so many people that unfortunately we can't save.
Okay, now let's,
shame.
since we do have to talk about it like very precisely as well, because of the fact that, you know, we do have other things to cover. So there's one more thing which I want to ask, and that is that, you know, whenever we talk about diabetes, obviously diabetes has an effect on each and every organ of your body, right?
Yes.
And then when you say that, you know, there are different levels of the disease itself, that, you know, if it's on the fourth stage, it's just literally gone out of the hands.
Yeah,
and people
proliferative diabetic
yeah, and people are
retinopathy
doing the magic as well. Now, for example, for somebody who's got diabetes, but his blood sugar level is in control, do you think it's going to affect the same way, or it's not?
It's not, but we should not presume that it's not going to do that.
Okay.
That is the problem. That is the point.
Okay.
If you have got diabetes, how good you are in controlling your disease, you should be going to your eye doctor once every year.
Okay.
So this
That
is
should
the
be a
kind of-
standard. That's just
well, this is an international standard. So
okay. So why don't people do it? Why don't people go here? What are the reasons when they come to you?
just, you know, how many people know that once they have got diagnosis of diabetes, they would be having a problem in their eye? How many people know?
Okay, and what are the symptoms of the first three stages which we didn't discuss as well?
Well, this is the important bit actually, because majority of the time the first three stages won't have any symptoms. Majority of times.
Majority of the time. Okay, otherwise then?
Well, that is the real issue. The first symptom in the form of bleeding at the back of the eye, when a patient is going to get, he would already be on fourth stage.
Okay.
And the only way to find it out or figure it out is obviously when you are actually looking at a patient.
Yeah, and so that's why the importance of regularly going and getting your eye checked.
Yes, it's just a prophylaxis, prevention.
And does the patient get to know that, you know, there's bleeding at the back of my eye?
Well,
do they have any
patient
idea?
would be the first person to know if
really? Because if it's at the back of the eye,
if you
I'm
have got
not sure.
bleeding at the back of your eye.
So okay, so for people who don't know,
because you'll lose your vision, as simple as that.
Oh, so you won't be able to see anything?
Well, you would, but it depends how much bleed you have got. Look, eye is like a tennis, not a tennis, probably a
let's see
table
if we
tennis
can get a
ball.
picture of this, guys, producers.
And even a drop of blood floating around inside the eyeball is enough for you to cause havoc.
Yeah. Well, when we get a hair in the front of our eye, it causes us so much pain and distress.
Exactly. It's such a sensitive. It's such a sensitive.
And what about all of those people who suffer from blood pressure?
Well, there are very well-known diseases actually that happens due to high blood pressure, and one of the very commonest thing is the retinal vein occlusion, which means due to high blood pressure, you can have stagnation or pooling of the blood flow at the back of the eye. Again, there are certain rules of thumb. For example, if a part of body gets deprived of oxygen, the rule of thumb is it dies, it finishes. So if someone ends up having a severe central or a severe branch part of the retina, retinal vein occlusion, they are going to lose, most of them, they can lose their functional vision. I'm talking about functional vision that you use to drive, to read. And hypertension or high blood pressure is a major cause. Same is the case with high cholesterol. Same is the case with so many other diseases that can affect you, for example, thyroid. So I think it's just a matter of promoting more and more awareness in our society.
Exactly. Two more things which I want to ask, and that is...
I'm not allowed to ask questions today,
I'm very sorry for that, but I've seen this. I've witnessed this over here in Pakistan, so, you know, we all know whenever we go out for shopping or we're roaming around F10 or F7 or F6, we do see a couple of people selling quite a lot of sunglasses, right? Which do seem that, you know, they're not of good quality and they might not use the best. They might not use the best glass as well. Do you think that these glasses can deteriorate your vision?
Well, you're really lucky actually that you're roaming around F9 and F10, because I'm from Multan, so I don't know. You are so coming back to your question actually, the thing is it's a dry land, and we have got sun there all the times. And we have got a significant amount of UV exposure, ultraviolet light exposure. So I think it's worth wearing wearing a UV protected sunglasses.
UV protected. UV.
No, so this is the thing. This is what we see on all the sunglasses, and then when you're buying the ones that are a bit more, they make more impact on the wallet. Now, how important is it actually to take these preventative measures? Do these also play a role in the later degenerative processes that take place?
There are so many myths actually because
let's bust some myths.
Because the problem is when we are talking about science, we need to have solid scientific evidence to make a statement.
Okay.
And there are so many things that I won't be able to explain or justify the way they are considered in the society.
Okay, so tell us some of the main things that you hear and you're just like, where did you get this from?
Well, for example, one thing that I hear pretty much every day is that if you are wearing glasses, your number would stop. It won't increase anymore. This is the kind of concept that parents have got towards their kids.
Okay. That's what doctors used to say.
Okay.
Bad doctors. Not doctors. Okay, let me correct myself. Not even doctors, opticians.
Okay.
Well, scientifically, it does not happen like that.
Okay, so can you tell us what happens?
Well, what happens is, let's take example of myopia, which is a kind of refractive error, which means you have to use glasses for distance.
Yes.
Now, the reason you are having that problem is because the size of your eyeball is bigger than what it should be.
Okay.
Now, this is something which has been genetically programmed in your body.
Yeah.
That means the size of the eyeball is getting bigger disproportionately to your body.
Okay.
Now, when you are growing up, your body is getting bigger and your eye is getting bigger as well.
Okay.
So the more larger, the more bigger an eye is, the more higher your number will be.
Okay.
So this is not important. This is not important for a kid. People would come to me and they would say, we had a refractive error of -2 and now it has got -3. What kind of doctor you are?
Yeah.
But the thing is, the problem
He's a smiling doctor.
But I can imagine you can only laugh.
But the problem is it's not my fault. It's not my fault actually.
Growing up.
That is not important. The important is that your kid should have the benefit of having a perfect vision as much as possible while he is growing up.
Exactly.
We can't stop him from going from -2 to -3. That is not important. It's just a change of number.
Okay.
He's still wearing glasses.
Okay.
The important thing is if he's going to his school, he should be seeing clearly. This is which is important.
Exactly.
Okay. So tell us one.
But it's a myth. It's a big myth actually. And
so I'm glad you told us.
I just get headaches
and
probably a dozen times every day.
Okay. So now that's one myth, and I'm really glad we cleared that one up. But what is another myth that you would like to bust on the show, which really gets to you and you really think people should be aware about it? What's another thing that you?
Can you give me a hint, actually?
Well, I'm not sure. I'm asking you because you're the.
Well, there are many actually. There are many.
Okay.
For example, let's take example of cataracts.
Yes.
The sufad motia.
Yes.
People would wait till their vision is gone.
Yeah.
They won't be going for an operation. Now look the way things have changed. 20 years ago, we used to make a cut in the eyeball. That's fine. That's fine.
Okay.
Yeah,
all right. It sounds painful.
So yes.
Okay.
So and the lens, the cataract used to come out.
Okay.
So you would have really wanted it really hard, so that you would open it up and everything is going to come out. Now it's opposite to that. We do not take the cataract out. We dissolve it inside the eye.
Okay.
Which means if you have got significant problems with the vision, the timely you get it done, the better it would be. You would have a better visual recovery. It would be more quicker. The amount of energy that we have to use in terms of using laser would be less. And it's a totally other way around as compared to what it used to be.
Okay.
Amazing.
And the last thing that you want to see in this age and era is a person coming to you with a cataract, waiting at home for last 5 years for his vision to completely wipe off before he goes and examines his doctor that whether he can do it or not.
Okay, that's really sad. But thank you so much for joining us.
It's a pleasure. It has been a pleasure.
I really feel like we've learned something a lot today.
Thank you very much. And for a couple of days, you can even stay here because it's going to be very hot in Multan.
That's very kind of you, but I do need to go back.
Because the weather must be really hot in Multan.
It is. It has always been like that.
Thank you very much for being here. But ladies and gentlemen, time now to move on towards our interesting facts. And today we have picked up on dates, which is also known as khajure in Urdu.
Okay, so they're very good because they heal the digestive tract.
They provide bone strengthening minerals.
They are great blood builders.
Natural energy booster.
They're an allergy relief.
Help prevent cancer.
They maintain a healthy weight.
Nervous system support.
And they reduce the risk of stroke. And also, just for a bit more detail, you guys, data are a good source of various vitamins and minerals. For example, they have great minerals like calcium, iron, phosphorus, sodium, potassium, magnesium, and zinc. And also, they have vitamins such as riboflavin and folate and vitamin A and vitamin K. I just thought you should know that.
Amazing that is, and in Ramadan, it's everybody's item of household keepers. I think that's what
Absolutely.
it is. But ladies and gentlemen, if there's anything you want to ask us, you can log on to our Facebook fan page, which is with the name of
Well This Morning.
On Twitter.
Well This Morning without a
on
G.
On Dailymotion and YouTube.
Well This Morning.
And the fabulous repeat is going to be at
11:05 p.m. this evening. Have a wonderful day. Have a good have a good fast, and we will see you bright.
Till the next time, 1, 2, 3. Good morning.